Assalamualaikum and good day to all. Today, I am going to share with all of you the outcomes of our study on a survey on prevalence of work-related musculoskeletal disorder symptoms, or WMSDS, among radiographers at Hospital Sultanah Bahiyah Alostar Kedah. This article is jointly written with another three members, which are Ms. Francisca Sili from the Radiology Department of Columbia Asia Hospital, Ms. Shin Ali Khan from the Faculty of Health Sciences, Taiwan International University, Sulaimaniyah, Iraq, and Ms. Nada Wazna Mazli, our bachelor's degree student who conducted the study. The following are the outline of my presentation. We'll start with an introduction, then the statement of problem, followed by the significance of this study, objectives, research methodology, then we will outline the most significant result with discussion before we conclude. Introduction. Today's most difficult occupational safety and health challenges includes stress at work, the health of employees, organizational productivity, and the country's economy are all significantly impacted, which is why it is a growing problem worldwide. In a newspaper clip from online News Straits Time portal, Tan Sri Lilangtai, during his time as the chairman of National Institute of Occupational Safety and Health, Malaysia, quoted that the major contributors to the escalating statistic of work-related musculoskeletal disease in Malaysia include due to aging workforce, industrialization, and a lack of safety standards and regulations in the workplace. A study by Summerich et al. In 2020 stated in recent years, several research has been done showing overwhelming evidence of work-related musculoskeletal disease symptoms among radiographers. This is reasonable given the nature of their work, such as repetitive movements in the patient's position, strong energy, manual handling, and prolonged sitting, especially in computed tomography or magnetic resonance imaging procedures. Several kinds of research have been carried out to investigate the prevalence and risk factors of WMSD, where the results prove that the work tasks performed by radiographers, such as lifting and moving patients, and the frequent operation of X-ray machines, mainly influence the presence of WMSDs. Okji Mac et al. In their research also discovered that the main causes of lower back pain among radiographers were prolonged standing and walking during the procedure, manual manipulating of equipment, and frequent repositioning the patient or X-ray cassette, which conclude that the physical nature of the radiographer's job was one of the factors believed to contribute to WMSDs. In addition, individual factors such as age, gender, and specialty in X-ray modalities also influence the development of WMSDs, as revealed in the study of Al-Ashamri et al. In 2019. Next, statement of problem. In accordance to Millennium 2022, the demand for radiology services were indeed higher, especially in tertiary referral hospitals, further leading to increased repetitive movements, static postures, muscle activation patterns, and the use of physical force to lift, push, pull, or move equipment and patients by the radiographers, considering the nature of their work activities. With the advent of the fully digitalized radiography system, many radiographers now spend their careers at computer workstations, editing images that involve or introduce an array of related health complaints. The act of transfer patients who cannot move well by themselves, pushing and pulling heavy equipment, were identified to be a major implication causes of lower back pain, while the repetitive movements, especially when using computers for function, such as image processing, the picture archiving communication systems, and the order communication systems, were known as implication causes of upper extremity musculoskeletal disorders. Hence, the radiographers also face unique occupational health hazards, which musculoskeletal injuries, and this exposure can be said to be increasing. There were not many studies investigating the prevalence of MSDs among radiographers that have been conducted, especially in Malaysia, because awareness of occupational safety for radiographers have been concentrated on radiation exposure safety compared to work-related MSD as reported by Albander 2021. So what is the significance of this study? Although a high prevalence of WMSDs among some groups of healthcare professionals have been reported in several studies in Malaysia, only few studies have been conducted on radiographers, even though they perform a great variety of tasks, and to our knowledge, little is known about the prevalence and risk factors of WMSDs among radiographers at referral hospitals in Malaysia. Furthermore, radiographers' occupational health risks have received insufficient attention compared to others. Therefore, the aim of this study is to assess the prevalence and severity of WMSDs among radiographers, as well as the relationship between demographic and potential risk factors in the development of WMSDs. We only focusing the study at one referral hospital at northern part of Peninsular Malaysia. Now, there were three specific objectives that we aim to achieve during this study. Number one is to assess the prevalence and severity of WMSDs among radiographers. Number two is to assess the significance of demographic factors and work characteristics on the prevalence of WMSDs. And number three is to assess the association between potential risk factors and the prevalence of WMSDs. Next, we move on to the research methodology. A validated self-administered questionnaire was distributed to all qualified radiographers working at Radiology Department of Hospital Sultanah Bahia. A total of 55 radiographers involved in this study met the inclusion criteria of at least 1 year of continuous clinical practice experience, a daily work period of at least 6 to 8 hours, and free from recent injuries or congenital defects. The questionnaires were adapted from previous articles that derived and modified from Nordic musculoskeletal questionnaires. There were 47 questions, which divided into three sections. Sections 1 related to demographic data, such as gender, age, work duration and experience, and specialty. Section 2 related to the assessment and severity of musculoskeletal symptoms, and Section 3 related to potential risk factors associated with WMSDs. All questions are closed-ended questions using dichotomous scales except for demographic data, WMSD severity, and factors of WMSDs were multiple choice questions. Chroma alpha values were calculated after pilot study were conducted, which involved 10 radiographers, and its reliability gave a coefficient of 0.83. Descriptive statistics were used to obtain the mean standard deviation and frequency of the variables studied. Chi-square test was used for both objectives in this study, which is to assess the significant association between the demographic factors and work characteristics on the development of musculoskeletal symptoms, and to assess the significant association between potential risk factors on the development of musculoskeletal symptoms. The statistical significance level was set at p less or equal to 0.05. Next, we move on to result and discussion. Referring to Table 1, we are looking into the socio-demographic frequency of respondents. Most of the respondents have work experiences as radiographers for more than 10 years. For daily work duration, most of them work for more than 8 hours. Right-handed dominance had the highest frequency, and in this study, majority of the radiographers specialized in general radiography and fluoroscopy with a total of 18 respondents. Now we are looking at Table 2, 3, and 4, where it shows the prevalence of work-related musculoskeletal disease symptoms in the past 12 months, 7 days, and interference of the body part in the past 12 months. The prevalence of WMSDs reported in this study was 100% with at least one episode of symptoms in any part of the body in the past 12 months prior to our study. we found that the most prevalent region of WMSDs in the past 12 months was lower back with 83.6%, followed by neck 67.3% and right shoulder 61.8% as highlighted. While in the past 7 days, region that was found to be the most prevalent was also lower back, followed by neck and upper back, where some of them were aware the interference of their symptoms on their daily activities due to lower back pain and also neck pain and upper back. It shows in Table 4. This was comparable with a finding by Ibrahim et al. In 2012, in which the most affected anatomy for lower back, followed by neck and shoulder in the past 12 months, while in the past 7 days they reported 44.1% cases of lower back pain and elbow pain and 39.5% cases of wrist pain. This was justified because of these three affected areas are often involved in the daily routine tasks of healthcare workers, such as twisting the neck, extending the shoulder to reach, manual handling and lifting, and repetitive work. Our study reported a higher prevalence rate of WMSDs than other studies by Lorusso et al. And Ibrahim et al., with 67% and 50% respectively. These differences in WMSDs prevalence rates can be considered due to differences in sample size, differences in exposure to ergonomic hazards, and differences in the physical demands of work tasks in each hospital. Table 5 showed the severity of WMSDs among radiographers. Despite there is no report on radiographers being hospitalized, and most of them managed to work with symptoms of low back pain, neck pain, and shoulder pain, nonetheless, there were some that having difficulties due to the symptoms. It was reported that some radiographers were required to change their duty temporarily due to symptoms of lower back pain, neck pain, and shoulder pain, while some were excused from duty due to symptoms of lower back pain and neck pain. Our findings shows that the number of absence due to lower back pain symptoms among radiographers was not in a concerning situation. Our results were lower than those reported by Arrowaye et al., who found that approximately 65.2% of participants were aware with the symptoms that interfering with their daily work activities, and 60.8% had made changes in their work habits, including changing the duties or amount of patient contact. The fact that it was reported that there was a high job demand and most of them work at least 40 hours a week may explain the disparity in their severity effect with the findings of our study. Previous study by Udo et al. Reported higher severity rate, and radiographers were reported changed their duty temporarily and 80.1% excused from their duty. Additionally, another study among radiologists by Heganava et al. Reported out of 74.4% participants with neck pain cases, some of them aware that their symptoms interfered with their quality of work. The possible explanation for this might be due to the prolonged and improper monitor positioning and insufficient neck support from the chair during radiographs viewing. Now let us see the association between body part with WMSDs. Table 6 summarizes the association between body part and WMSDs. A few socio-demographic variables such as work duration, handedness, imaging modality specialty were found significantly associated with the WMSDs in certain of body part. Daily work duration showed significant association with the prevalence of WMSDs of left shoulder pain, which is consistent with the previous studies by Daniel et al., where 93.3% of the respondents who work 6 hours and above with daily high caseload has higher incidence rate of developing WMSDs. Additionally, our study found significant association between hand dominant of radiographers with neck pain and right shoulder pain. This can be explained by the fact that overuse of the dominant arm or hand in handling tasks can lead to the repetitive strain injury. In another perspective, emerging modality specialty were found significantly associated with prevalence of upper back pain, one knee pain, and one ankle pain. Lorusso et al. Found that physical workload or work tasks had a significant association with the prevalence of WMSDs. About 62% of the participants in his study reported working in the department such as general radiography, interventional radiography, emergency and mobile radiography requiring a high physical workload. It was supported by Landry et al., which suggested the nature of specific duties in procedure such as patient management and lifts or transfers of patient may be more predictive for prevalence of WMSDs. Next, Table 7 is the association between potential risk factors with WMSDs. There were 5 activities that lead to potential risk factors which associated with prevalence of WMSDs. Lifting of heavy load or patients was found correlated with prevalence of low back pain. Repetitive movements such as bending and twisting of lumbar region shows significant association with prevalence of low back pain and upper back pain. This suggests that frequent flexion and extension during manual lifting of heavy loads expose a high stress received by the lumbar region, consequently increase the risk for back injury such as internal disc disruption and annular tears. Radiographers wearing heavy lead gown for long periods as WMSD's potential risk factors had shown significant association to the prevalence of right shoulder pain and left wrist pain and hand pain. Many studies suggested that overuse of lead gown was associated with a high prevalence of musculoskeletal problems, mostly those related to the spine. In the study by Goldstein et al. And Burney et al., both found a high prevalence of a history of musculoskeletal problems involved spine injuries, significantly associated with number of years by physicians performing invasive procedures. As we know, invasive procedures related to the requirement of wearing lead gown. Consistent to the study by Klein et al. And Orme et al., which found significant association between a history of WMSDs with fluoroscopy-guided procedures requiring a lead apron with 67% increase in the prevalence of musculoskeletal pain. There was also a significant association between excessive stretching of the neck and prolonged stretching of the shoulder to the occurrence of WMSDs. As it's supposed to be, neck pain and shoulder pain usually occur during the handling of X-ray tube, especially with a ceiling-mounted tube, as the radiographers were usually required to work with one hand above shoulder level to reach the X-ray tube, extending the neck and shoulder to position the X-ray tube parallel to the centering point of region of interest. Our study indicates that clinical radiographers at Hospital Sultanah Bahia Kedah are not exempt from high risk of WMSDs. However, the severity level is still manageable as majority of them manage to work with their symptoms. This study found that most prevalence of WMSDs was related to the nature of the radiographer's work tasks rather than demographic factors. Hence, there are many ways involved in the reduction and prevention of WMSDs. For instances, micro breaks of 2 minutes every 20 to 40 minutes, changing posture after a prolonged static posture, and reduction in the patient manual handling are all the methods that should be implemented by radiographers during their duties. Well, that's the end of my presentation. We would like to thank all the respondents at the Radiology Department of Sultanah Bahia Hospital who were willing to participate in this study and for their cooperation throughout the data collection process. The authors would also like to thank the UiTM Research Ethics Committee and the Internal Research Ethics Committee of Faculty of Health Sciences, UiTM Selangor Branch, Puncak Alam Campus for approving of the ethics in conducting the survey among the radiographers. So here is a list of references that we used to develop this presentation. With that, thank you for your kind attention.